Viewpoint, program of personalities, politicians, and perspectives. And I certainly have part of that right next to me here. My assistant co-host today, our assistant co-host. Nobody's going to replace Judy Busby, but you will take her place for the day. Julie King. We're very happy to have Julie King with us. Julie here not only is a co-host, but is here to aid and abet the old geezer as we as we discuss the disease of Alzheimer's. And we're going to have Mr. Adam Castelli call in very shortly here. Adam is with the Illinois Alzheimer's Association and give us an insight. Why am I here? Seriously, this is people make funny remarks about Dad and old Granny, a little off the rocker and so forth, and it's kind of sometimes a little cute and so forth. But that's a very, very insidious, serious disease.
It is.
And Julie works with folks in her capacity there with the Christian Nursing Home at the Christian Village. And so she can bring her degree of expertise to this. Julie, we always try to start out with a kudo. In this case, we're going to have two kudos. I noted this morning where John Barrick and his daughter Erin went over to Peoria to some of the truck dealers' big show over there, and they did very well.
Yes, I saw that in the newspaper
very
this
neat,
morning.
And pretty neat father and daughter working together.
Yeah.
Together. So kudos to John for the time he's putting in it. Kudos to Erin for what she's doing there. It looks to me like she plans to participate in the future and going to start work already on the next year's racing model. So good for her. Also, I noted with great pride that the Lincoln College wrestlers, all of them, qualified for the national tournament. That's a big deal.
Yes, it is.
So we're very, very happy to bring that news to us. I have a couple of housekeeping matters that we have to take care of here. I'm told by going to the Shrove Tuesday pancake supper last night at church instead of going to Old Joe's.
Good choice, Bill.
I find that we have a new association in town, Jim, Logan County Art Association, and they're going to have a show, and it's going to be called It's All About Love. They're going to feature some local artists, George Burchett, Lee Hahn, Wilbur Hill, Jason Huffman, Bonnie Mayo, Moses Pinkerton, Carrie Rolowitz, Christopher Tice, and Randy Worsham. Now, they're going to have some things on display here, and it's going to be at the Lincoln Art Institute, and that's 112 South McLean in Lincoln. That'll be right next to the post office, of course. So they're going to have a little demonstration, a little art show there. The date is going to be January the 24th, and if anybody has any questions, they can contact George Bouchard at 819-6801. So another little avenue for the arts and so forth here in Lincoln, Logan County, and that's pretty neat. These folks are doing that. And now we have another art form, and that's visual theater. And Tom Quinn has formed made a film called Using, and the name of his firm is the organization is Phenom Features, and the point of it is that Tom has made a film here of this particular subject. It's a dynamic, engaging, and socially relevant film about using and so forth. Tom wants to enter that in film festivals and so forth, and they're going to have a fundraiser March the 9th at the Elks Club at 6 p.m. Going to have some auctions, 50-50 drawings. It's a good cause, good purpose. Tickets are not real inexpensive, but it's also a very, very good cause, and I commend them to you. If you will contact Kim Peterson Quinn at 871-0387, or Tom, who's assistant professor at Illinois Wesleyan University, by the by. Tom's number is 871-3399. Go out there and enjoy yourselves here on March the 9th. Be a nice evening at the Elks Club. Tickets are $100 for a couple, and that will have you a nice evening. So commend that to you. Now, Julie, while we're waiting for Mr. Castelli to call,
yes,
let us describe what your current duties are. You're working with folks in the Christian Village, a retirement center, but nonetheless you've had considerable experience working with folks who have Alzheimer's across the street there.
I did.
If we have just wait, we may have a call, and is that our call? All right. Okay. We'll slip our headsets on and say good morning to Mr. Adam Castelli. Good morning, sir.
How are you doing?
Well, we're doing fine. We appreciate your call this morning, sir. First and foremost, I'd like for you, Mr. Castelli, to tell us your title and the scope of that title. Why are we calling you? As a matter of fact, why am I here? Seriously, why are we? Your expertise in the field of Alzheimer's is something that we should know about, Adam.
Yeah, I totally agree. My title is the Manager of Program and Support Services, and so that basically means that in Springfield, I am the foremost authority for the Alzheimer's Association on what to do, if you have a family member affected by Alzheimer's, or if you need more information about the disease.
Well, we're happy to have your expertise with us. This, as I said earlier, as we were just coming on, it's such an insidious thing and can kind of slip up on people. Now, at my advanced age, I've become more aware of some of my contemporaries. They're having some serious problems. And the fine line is that is it just old age, or is it the beginning of Alzheimer's? And I'd like to ask a question here, sir. Dementia versus Alzheimer's. Would you differentiate that for me?
Yeah. So dementia, when you say the term dementia, that's kind of the blanket term, the overall term. And it doesn't really tell you what's going on. It just kind of gives you an idea that somebody's got something going on, something in their brain that doesn't allow them to live their life normally anymore. Now, Alzheimer's disease is the most common cause of dementia. But when you say dementia, it can mean, it's kind of like saying you have a fever or you have a cough. It's a symptom, but it's not the disease itself.
Oh, okay. When does one first begin what are some of the real pertinent signs that a family should begin to recognize, other than the fact, well, Grandpa's over the hill?
Yeah. The big one, the one that you kind of, if you've ever seen a movie or if you ever have known someone who had Alzheimer's, the big one that people really notice is that you lose your short-term memory. And, a lot of people have trouble with their memory, but the way that we usually phrase it is that you don't just forget, the word that you're going to say, or you don't forget exactly what day it is. You forget, and then you forget that you forgot. You have no context for what was going on around you. So a lot of times people with Alzheimer's can sort of ask the same question to their family members over and over. That's a big sign because, not only do they wonder, they want the answer to their question, but they don't even remember asking. They don't even remember receiving the answer in the first place.
Now, from that point on, then, Mr. Castelli, does it begin to just go downhill? And I presume with each patient at a different pace, some deteriorate more rapidly than others?
Yeah.
I'm asking a question about how quickly one could begin to say, oh boy, we better find a facility for daddy or mommy or something like that.
And that's where a lot of the just guilt and the really tough part of Alzheimer's comes in, because ultimately a lot of times, a younger family member can become responsible for an older one. And the time when that's decided, it's really, an individual thing. We always preach that people should try and get that diagnosis and get the treatments that are available as soon as they can, because what that allows them to do is sort of participate. They can still say, this I want to do, I know what's going to happen to me later, and so this is how I want things to happen later on. If you want to stay at home, it's really expensive, so you have to plan ahead for that. If you're okay, go into a home, you can go tour the homes that are available, you can meet the staff, you can kind of participate in your own care a lot more actively, and you can make those decisions for yourself, because later on in the disease, people have a symptom called amnesia. They don't even know that they're sick. Sometimes they don't even know what year it is. So they before you lose all that place, you can still make the decision for yourself if you get treated early. Now, earlier at the question, you said about, the pace that the disease goes, the way that the damage occurs. And so, when Alzheimer's happens to a person, it's a progressive and it's a fatal disease. And so what that means is from the first symptom to the last symptom, there's no way to stop or slow that disease down. It progresses on through. So that allows to go through just a lot of dread and anxiety about what's going to happen to them later. But it also allows them to have a pretty good idea of what the risks are and what's available for them later on.
Yes, go ahead, Julie. Listen, Mrs. King, you jump right in there anytime you want to. My co-host does that, and I want you to do that too. You go right in with questions or comments, please, Julie.
Adam, I have a question for you in regards to the diagnostic tools used to determine whether a person has Alzheimer's type dementia or if they just have a senile dementia of the non-Alzheimer's type. What could a person anticipate if they go to look for that diagnosis?
Yeah, well, a lot of primary care doctors are capable of them, if it's Alzheimer's disease, because the disease is relatively common, relatively speaking. One of the big things to give is mini metastasis exam. And it's a questions, and the questions seem silly people, spell a word backwards, count down, or what day it is, or what week it is, things like that. But what those questions do is it's basically a tour around your brain, and it tells you, how effective each part of a brain is at that point in time. Mm-hmm. And so when you talk about different types of dementia can affect different parts of your brain. And so Alzheimer's really starts in that short-term memory. And so if a person is having trouble figuring out where they are, how they got there, those are the questions that they'll have trouble with. Whereas if a person has a dementia that maybe affects their vision, personality, something like that, then that dementia is going to show up on a different set of questions a little bit later in the test. And so that's the big one. And the other thing is that a lot of the diagnosis, because you can't kind of open somebody's head inside.
Right.
A lot of that diagnosis is up to the person to say, this is what's going on with me, what does it mean? And for their family members to be there too and to say, here's what I saw last year, here's what I saw this year, and this month, this is what's happening, because it goes in that direction.
Go right ahead. You had a comment you wanted to ask, Julie. I thought you said you had something.
Oh, you mentioned the mini mental exam. Is that readily available as a tool? Is that readily available to any physician? For instance, here in Lincoln, our primary care physicians could administer that, or would they need to come to Springfield to the Bayless building or something and have that done?
Yeah, in Springfield we have a set of really great neurologists who can tell you, the difference between supranuclear palsy, which is a much rarer type of dementia, and, frontotemporal lobar dementia. Mm-hmm. So there are various different types. Because Alzheimer's is more common, some primary care doctors, so I can't speak to exactly which one you may be at in Lincoln, but some primary care doctors in a town like Lincoln will be able to kind of go through that history, go through, this is what's been going on, what's available for my symptoms, and be able to give a person a pretty solid diagnosis. Now, if you're not fully confident in that, or if your doctor recommends it, then it's always a good idea to go ahead and get, more testing. And even at SIU School of Medicine, where they have the neurologists who work on this disease exclusively, even they can tell you, well, we can do this 30-question test, but if you really want to know exactly what stage you're in, then, it might be a 3-hour test. It may be this much longer-term evaluation. And just because of the way that a disease affects someone, because it's kind of in your head, people can have good days and bad days too, and so, if they come to the office good day, ace the mental test, they say that they feel perfectly fine, and so that's another reason that kind of getting that progression, getting what's been going on and how has it been getting worse, or if it seems like it's getting worse or seems like it's just kind of staying the same, that's really visible to that diagnosis.
Sir, you mentioned stages, and what are those stages, different stages of Alzheimer's? The beginning, I guess, is where they just, I'm presuming, that's what they begin to exhibit short-term memory. Is that really the first type of knowledge that we might have a problem with grandmother or grandfather or father or mother?
Yeah, the way that the earliest stage works is it's kind of called the pre stage, and the symptom at that, don't call it dementia. If you get a diagnosis, they'll diagnose you as having is mild cognitive impairment, and that doesn't mean really that you have Alzheimer's, but mild cognitive impairment is basically you have something going on where you're not quite yourself, but you can still kind of make it through the day. You can kind of live normally, especially if you get treatment. And so that's also known as the preclinical stage of Alzheimer's, where you can't really get that diagnosis that's solid. You know, this is what it is, this is what we should do. Then in the early stage of the disease, yeah, it is short-term memory problems, and then people also have problems with vision. They can have problems with depth perception, which makes it real for people to drive or get around. Mm-hmm. And then as you go through the late stage of the disease, it kind of expands through your brain, and so it can affect different parts. It can give people, it can sort of turn a person's personality from kind of being, you know, mellow. Sometimes a mellow person will become aggressive, or a person who was really outgoing will become apathetic. They won't want to really do anything. They won't really want to talk or move around. Then later on in the disease, it basically makes it, you know, more and more tough for that person to take care of themselves. So early in the disease, it may be you need to start checking up on them every week or something like that to make sure that the bills get paid and that the lights stay on. In the middle stage of the disease, you may have to start checking up on them every day to make sure that the medications get taken, to make sure that they eat and clean up and take care of themselves, that they don't wander off. And then by the late stage of the disease, it's every hour. You know, it's a person needs care all the time because they don't have the capability to take care of themselves at all.
How important would you say socialization is to a person with Alzheimer's type dementia?
Socialization is one of the things that boosts your mental capacity. And so there have been studies done where people were sort of donated their blood to science. And people who were well socialized, really active, had a sort of a routine that they went through, they may have had damage in their brain, could have given them a diagnosis of Alzheimer's disease. While they were alive, they never had that because they were active enough, they were out there enough, and they were early enough in the disease so that it didn't really appear. And so, you know, it's important to stay active, to socialize, to have those things that keep your brain kind of acting or kind of working, kind of staying flexible. And, you know, we don't say that it prevents it, but it can definitely make it a lot less apparent in people.
Mm-hmm.
648-55, excuse me, please, 648-5510. Somebody out there in the ether land has a family member that you might have a question about. You certainly feel free to call us. Mr. Castelli will give his best to answer your question. At what point in time did the word Alzheimer's come into the jargon, sir? Mental disease, of course, has been around since millennia, since we became humans. And of course, they kept the old folks at home, or what in the world did they, you know, in the early days, certainly Alzheimer's in its whatever form it was, that they had to be taken care of somehow, and must have been a terrible problem. Now we have, of course, a multitude of places that are available to us. So When did the word Alzheimer's come into the lexicon, sir?
Yeah, Alzheimer's has been known by a lot of different names over the years. So it was senility, or it was the arteries was the diagnosis. The itself was diagnosed, and named Alzheimer, and that was in the late early 1900s. But the diagnosis itself has become more common because it's sort of the double-edged sword. As people are living longer and being more active later on in their lives and not staying out on their own or just kind of dealing with these problems on their own. As people live longer, the disease becomes more common because one of the big risk factors for Alzheimer's is age. So it's really been, only in the last probably 20 to 30 years that people have really realized, Alzheimer's, that's not just grandpa's getting old. It's a disease, it's not normal, and it's something that we need to get looked at and get diagnosed and treated.
We're going to take excuse me, sir. We're going to take a quick minute for commercial break, and we'll be right back to Mr. Adam Castelli. Thank you very much. We'll be right back, Adam.